further ado, I'd like to start proceedings with a chap who is just new to this industry, and he's starting to get to make some noise in the media. Just a little bit of flutterings here and there. It's Dr. Aseem Malhotra.
Good morning, everyone. Can you hear me at the back? Yeah? Great stuff. Great stuff. Well, really delighted to be here to start the kickoff proceedings this morning. I'm sorry I wasn't able to be here yesterday. I was actually in Prague to give a talk, which unfortunately I had to cancel because I've been pretty sick for the last several days, but I've got just enough energy to hopefully get through the next 45 minutes. But if I don't, there's enough doctors to resuscitate me, I think, here today to sort me out. Okay, so I'm going to take you a bit of a journey, which is going to involve some science, some politics, some intrigue, some hope, ultimately. And I think that's what we need more than anything with what's going on at the moment. My talk today is some lessons in public health advocacy. I want to give a special thanks to Professor Simon Chapman, who you will know a little bit more about by the end of the talk, who's a public health professor in Australia. So some of you may have seen this slide several times because I've given it in a few talks recently, but I think it's a really important slide because as a doctor, we want to practice evidence-based medicine so we can improve outcomes for our patients, but not just for us as practitioners, as healthcare practitioners, but also for us as patients. When we go and see the doctor, we want to make sure that we've got somebody who uses he or she uses individual clinical expertise, uses the best available evidence, but also takes into consideration our values and preferences. Sadly, evidence-based medicine has been hijacked by commercial influence, and I think there are lots of things that are going on that hopefully will make medicine great again. That's what we want to do. And patient values and expectations, I think, are crucial, again, are being missed. And, you know, the father of evidence-based medicine, of the movement, Professor David Sackett, said half of what you learn in medical school will turn out to be either dead wrong or outdated within 5 years of your graduation. The trouble is no one can tell you which half, so you have to learn on your own. And over the last several years, I've been doing that, and many people with me have been doing the same thing, that we're trying to, you know, the science evolves, how can we resolve the current crisis that we're in? And one of the reasons, the main reason that many of us are here today, many of us are campaigning and doing what we can in our own communities and in different medium, different platforms, is because we have this big public health crisis. You know, more than 60% of the adult population still remain overweight or obese in the UK. 1 in 3 children in the same category. And the costs are really astronomical. Type 2 diabetes is costing the NHS £20 billion a year. That's from direct costs to the NHS and indirect costs to the economy. And the trend suggests that this will hit 40 billion unless we act appropriately. And I think, you know, when I started my journey, you know, I think one of the things I understood at the very beginning is that, you know, we have an obesogenic environment, that the processed food environment is actually probably the #1 factor. We can argue about dietary guidelines, and we'll come on to that later. But ultimately, the fact is that the reason we're having this problem of obesity is that the default choice has become sugary processed foods wherever you go. And what really inspired me is that, you know, the biggest scandal really is the fact that we allowed our hospitals to become a branding opportunity for the junk food industry. And the summer of 2010, I was working as specialist registrar in Harefield Hospital, and I'd performed an emergency procedure in the middle of the night on a patient who had a heart attack. And we saved his life, and the next morning on the ward round, as I'm trying to, you know, tell him to take all his pills religiously, including statins. We know the magic drug statins. And, you know, talking about stopping smoking, healthy diet, he gets served a burger and fries, and he looks at me and he kind of, you know, is perplexed that this doesn't make any sense. You know, you're telling me about healthy diet and I'm served a burger and chips. So I looked around and I realized also that many hospital staff were also suffering from the same problems of diet-related disease, overweight or obese. And the first thing I did, actually, I remember that lunchtime, I actually decided to write an email to Jamie Oliver. I'd been inspired by what he'd been doing and highlighting how bad school dinners were. So I wrote to him and said, well, listen, we need to sort out hospital food. Can you get, you know, can you make this part of your campaign strategy? And I wrote an email, and I didn't expect a reply. I got an email address from a friend of mine who's a journalist to his PA, and about 6 weeks later he replied. And we ended up meeting for dinner several months later. And he organized a dinner with several doctors. And I think there was a consensus of opinion that actually, yeah, we've got an obesity epidemic. Hospitals should be certainly setting the right example. And I wrote a piece in The Observer a few months later, which I didn't predict. You know, the editor thought it was so important that he put it as a front-page comment piece. And the significance of that piece was that, you know, even I was shocked that it was a front-page comment piece of The Observer, which is, you know, a very prominent newspaper in the UK. I mean, a newspaper that I learned later on, Winnie Mandela said, was probably the most significant, most important newspaper campaigning for the release of Nelson Mandela. So as a campaigning sort of newspaper, certainly it was a good opportunity to get a message out there. And they put it as a front page. On the second page, they had half a page from David Cameron as a new Prime Minister. So that's how important they thought this was. And I was like a bit overwhelmed. I was only a specialist, still a junior doctor at this stage. So you can imagine, you know, there may have been I got a few looks in the hospital from some of my colleagues and my bosses. There wasn't really any congratulations from anybody, to be honest. But part of that was because they didn't get it. And we know that, still there's a big problem with doctors' understanding of nutrition, how it impacts on health. But anyway, I wrote that piece, but then I thought, you know, there's more that needed to be done. And less than 2 years later, I wrote a piece in the BMJ, really putting the evidence together. I mentioned the slide at the beginning, so we had to make a case for what is the evidence, first of all, that this is important, that hospital food impacts upon patients and staff. And actually, there was a lot of good evidence that actually becomes, you know, people become more acceptable. You know, there's data in the States that shows that, you know, visitors that go to hospitals who sell junk food on site are more likely to buy junk food when they leave the hospital. So I put those all together and said, we need to stop selling sickness in the hospital grounds. And it was press released and it was picked up by BBC News. And then on the same day, I'd actually strategized this as well. I'd already planned a few months in advance that I was going to get up in the British Medical Association house and give a speech to time with this piece, which also hit the news. And I got up and gave a speech and in BMA House to make sure that the British Medical Association made it part of their policy that we need to ban junk food from being sold in hospitals. And I gave that speech, and overwhelming majority, there was some opposition, 97% voted in favour. So we then got the BMA involved, and that was really important that there was a consensus amongst doctors. And just moving forward, I'm really delighted that only a few months ago, I learnt that my local hospital, where I grew up in Tameside, just a few months ago, was the first hospital to ban all sugary products from the canteen. I spoke to the chef only a few weeks ago, who I'm going to meet tomorrow for the first time. And he had actually been following a lot of this stuff. He himself had a family history of type 2 diabetes, etc. And he'd been following a lot of the work. He'd been following Tim Noakes' work. He'd read my book. He was using recipes from my book in the canteen. And there's already having amazing results with their staff. So I think, you know, what's amazing is they've actually banned all high glycemic index carbs from the canteen of the hospital. So I think they deserve a round of applause. Tameside. So I think this is probably the first in the world hospital to have low-carb options in their hospital, which is amazing. So hopefully this is a start for more things to come. Okay, what else do we know? Well, when it comes to poor diet, it is responsible for more disease and death than physical inactivity, smoking and alcohol combined at the moment. We know nutritional science isn't perfect, but certainly it's quite clear that the poor diet is the major issue. Now, when you look at poor diet, this shocked me actually a few months ago. This was published as a news story in The Guardian from a report that came out, which basically suggested across Europe they linked, and it's probably not surprising, ultra-processed food consumption with obesity across many countries across Europe, and England was one of the worst, UK was one of the worst. Half of the British diet is now ultra-processed food. Half of that diet. Now, where do you think where is that ultra-processed food? What are the food sources of that? Is it fat? We keep still hearing dietary guidelines that we need to get saturated fat down, we need to get fat down. Well, no. You know, the evidence is telling us that ultra-processed food, most of that is coming from starch, sugary drinks, sugary products, ultra-processed fruits and vegetables. On this it says fats, 2%. I was even surprised at that, 2% from fats. Now, Vegetable oils are clearly a problem. I suspect some of that is vegetable oils. But most of the consumption of ultra-processed food, which is clearly the problem, is coming from starch and sugar. So as Sam coined the phrase for public health collaboration, real food really does rock right now. It really does rock. Okay, putting it in context, if we're going to sort out the population-wide problem, then I think I need to reinforce this message that it needs a population-wide intervention. And Tom Friedman's health impact pyramid tells us that making the default choice is going to have the biggest impact, the healthy choice is going to have the biggest impact than counselling or education is. Education is, of course, important, but it will not be helped unless we actually make sure that everybody has the opportunity to have healthy food that's affordable. And the reason for that is because these policy-based interventions, which include regulation, such as taxing junk food or sugary drinks, will have the potential to reach all parts of the population, even people who will not have the opportunity to have very specific education, so their default becomes that they're eating more healthy food, which has less sugar, certainly. So let's just go back in time a little bit here. So, you know, the sugar issue has been raging for several decades, actually, and John Yudkin was, as you know, was the British nutritionist who said sugar was a real problem in relation to heart disease. But he was hung out to dry. He was on his own. He didn't really have much support from many other people, and his own research had analysed, suggested sugar, not saturated fat, was a problem. But when he came out with this, there was lots of various industries, in particular the sugar industry, that attacked him. They did various things to impede his work. You know, he was called names. They interfered with his research, publication, his funding, and sadly, you know, Ansel Keys at the time, as you know, he proposed saturated fat was the main cause of heart disease, and you know, there was rancorous language, personal smears. I think this is important to remember this stuff because, you know, he that does not remember history is bound to live through it again. And I think there are lots of examples I'm going to come on to how history could be repeating itself at the moment. And Yudkin died in '95, and his warnings were no longer taken seriously until Professor Robert Lustig comes along, pediatrician, University of California, San Francisco, and he gives a talk which has now about 6 million views, where he says sugar is the real culprit behind type 2 diabetes and heart disease, not saturated fat. And he also wrote an editorial in Nature. Now, in my journey over the last few years, when I was doing all of this started my campaign on obesity and trying to improve the obesogenic environment, I looked at Lustig's work. And I thought to myself, wow, this is really impressive, but this guy seems to be on his own, but he's getting attention here. So let me look at this as well and see what I think. You know, does this make sense? How can I apply this to the British population? One of the things that was really interesting, which really resonated with me as a cardiologist, is many of the patients that I was coming in with, who were coming to my hospital, who I was treating with heart disease and having heart attacks, they weren't obese, but they all seemed to have the phenotype of metabolic syndrome. And that's crucial because when you look at the data on sugar, the implication, the actual science is telling us that it seems to be promoting metabolic syndrome through insulin resistance. And actually, 66% of patients who are admitted to hospital now with heart attacks fulfill criteria for having metabolic syndrome. 75% of them will have normal cholesterol, and more than 50% will have so-called normal LDL. So for me, that was what Lustig was saying, was sugar was actually, its impact on health was independent of calories. And that really resonated with me from my own observations. So I started looking into this myself. I thought the science was very robust. It was strong. It made sense. And the other thing as well is that, you know, the slightly crude slide is that there's no such thing as a healthy weight, because about 40% of people with a normal BMI will harbor the same metabolic abnormalities as people with obesity. Now, I'm not saying obesity isn't an issue. Of course it is. You can have an unhealthy weight, but there's no such thing as a healthy weight, only a healthy person. So I think that's a really important concept. So I started looking at all of this stuff. I looked at the American Heart Association, and Lustig, in fact, had actually infiltrated that particular recommendation. And this was in 2009, and the American Heart Association's own analysis at that point has suggested that we should have no more, the average male should have no more than 9 teaspoons of sugar a day, of added sugar, and for the average female, adult female, 6. For the average 4 to 8-year-old child, it was suggesting no more than 3. But the average intake in America was saying that, you know, suggesting that they were having 22 teaspoons of sugar a day, which is really quite a lot more than what they were recommending as a maximum limit. So I was trying to understand why that was. And interestingly, I looked at how did this apply to Europe and the UK, and the first thing I did is I went to a supermarket and started picking up some products and looking at, because I wasn't sure, I didn't understand, what were the recommendations on sugar in the UK. Maybe they were up to date and reflected the science, but they weren't. In fact, the European Union, in fact, all countries throughout Europe were recommending 22 teaspoons of sugar a day as part of a healthful diet. It's quite extraordinary. And they'd been doing this for a long time. So I started to investigate this to work out how had this all happened. And I even went to the root source. I spoke to one of the public health nutritionists who was involved in the guidance. And what I found was really quite shocking. Basically, what had happened was the food industry had really hijacked the nutritional information when the public health nutritionists were essentially suggesting sugars as part of, what you find in fruit and vegetables, whole fruit and vegetables. I know there's some debate about that, but certainly whole fruit and vegetables for most people is not a problem. They had hijacked it and basically suggested that what you get from a can of Coca-Cola, or what they're adding, is exactly the same sort of impact on your health from a food which may be an apple or an orange, for example. And that is how they had managed to hijack this information. So a Mars bar, for example, which has about 8.5 teaspoons of sugar, was giving similar advice, saying this represents 30-odd% of your guideline daily amount, which is really quite shocking. So I looked at this a little bit more. And I found out also in America, they didn't even have any GDA for sugar. So none of the consumers in America were allowed to really be able to decipher how much sugar they were consuming or how much they should be. And that's important because actually about 50% of what's being consumed in America through added sugar comes from foods that isn't associated with junk food. So you could argue, okay, well, people know, biscuits and candies and chocolates and ice creams are junk food, but actually about 50% of what they were consuming of sugar, their sugar consumption was coming from things like bread and salad dressings and foods they wouldn't consider to be junk. So that was clearly a big problem. So what else did I look at? Well, the other thing that was a real bugbear for me as well in all of this, and I had kind of been passively absorbing this information myself, although I didn't intrinsically believe it, was that the whole problem of obesity was due to lack of activity. It wasn't because of what we were eating, it was because we were more lazy now than we were 30 or 40 years ago. And I looked at, some of there was a paper published by Kelly Brownell that really was a brilliant paper, which really looked at the food industry's sort of corporate playbook to deflect blame, their role in obesity and how they'd influence dietary advice. As well as policy, was basically they had focused on it being personal responsibility, nanny state, anyone who wants regulation nanny state, but neglected, we neglected to understand that actually most of our increase in life expectancies happen from public health regulations, whether it's involve safe drinking water, seat belts in cars, smoke-free buildings. And they did various things like corporate social responsibility deals where when one particular city in America was considering a soda tax several years ago, one of the junk food industry companies gave the local hospital $10 million, which was nothing for them, and essentially the sugar tax didn't happen. And the other thing that I think that's quite crucial as well is that, is this as well. So people who are speaking out, they call them out, they have their trolls, they have their representatives calling them food fascists, perpetuating junk science, all sorts of smears. So that was something that I was aware of at the time. Anyway, physical activity over diet, as we know, when you look at the data, yes, exercise is great for many things. You've heard it yesterday from Zoe Williams. It's a very, very good, I would call it almost like a pill if you do it the right way. But when it comes to obesity, it's almost all what you put in the top end. And the denialism by the food industry was, tobacco industry, which again managed to stall into, any government regulation for many years from the first links between smoking and lung cancer, involved, denialism where the CEOs of every major tobacco firm went in front of US Congress in 1994 and they swore under oath they did not believe nicotine was addictive or smoking caused lung cancer. Anything to protect profit. So I'd been gathering all of this information, and essentially I wrote a commentary in the BMJ in May 2013 because sugar was having no attention. I was reading about this stuff, I was looking at the labeling, there was some information suggesting we were probably, and I was looking around me and seeing all these people going and buying low-fat foods. I remember where I live in North London, there was a fat-free ice cream place, and it was just a line of people, and I looked at them, and most of them were overweight, and they were there, sort of gorging on this 0% fat smoothies or ice cream. And I thought, this is just nonsense. I mean, do they know that sugar is probably causing them a lot of harm? So I put this all together in a piece, and I basically, highlighted that the Scientific Advisory Committee on Nutrition, that was responsible for the guidelines, I'm calling them out and said they need to update these guidelines because actually we are giving harmful advice to the public, and this is causing, in my view, type 2 diabetes and contributing to obesity. And the BMJ press released it, and in fact I remember calling Tim beforehand. Now, in those days, I'd kind of realized from other work I'd done that actually when a press release, the likelihood of it having more impact is if you have other people supporting you who have authority, then it's more likely to hit the news. So I had support from a number of people, and Terence Stevenson, who at that time was the chair of the Medical Royal Colleges as well, which was very powerful. And I called Tim, and Tim also gave a very powerful quote about this as well, about sugary drinks in particular being harmful. And it was picked up by the press, which was great, because I thought that was a good start to try and get it into public reach. And I went on BBC Breakfast and I talked about it. And basically, there was no one from the soft drinks industry or the food industry that was willing to debate me, which really for me was very, very telling. In fact, Bill Turnbull said this to me at the very end after when we went off air. He said, it's very telling, Aseem, that nobody came to debate this with you, that people are being misled about sugar. So that really started the ball rolling. And then a few months later, this became one of the probably most controversial articles I've ever written. And again, it's great to have so many inspirational characters here today. I mean, Zoe Harcombe, I'd started reading her book. My father had actually recommended it to me. He hadn't read it, but he'd read the reviews about it. So I started reading Zoe Harcombe's book, and I was really fascinated about her take on calories and saturated fat. And I read it in a lot of depth, and I then started looking at some of the research around it and sort of looking at all the information. But one of the other things I was realizing at the same time is that we were giving statins to many of our patients, a lot of them were getting side effects. To try and understand why saturated fat doesn't cause heart disease, you then have to realize that cholesterol isn't linked to heart disease either, or certainly the link is weak. So I had to put the jigsaw together. And in fact, a lot of people warned me afterwards, said, Aseem, why you can go after the food industry, why did you go after the pharmaceutical industry at the same time? And it's still having a knock-on effect now, but basically I said, yeah, saturated fat wasn't the problem, and we need to focus on sugar, but I then added in, we've also over-medicated millions of people on statins, and really we should be going down the Mediterranean diet route, which is, according to the randomized control trial data, much more effective than statins. Now, this had a huge impact, and I think there were lots of other people independently doing things at the same time. Nina Teicholz was in the middle of writing her book, which didn't come out for a few months later. Zoe had already written a book on the saturated fat issue as well, and I really wanted to give it more publicity. In fact, I referenced Zoe's book. I'm quite sure I referenced your book certainly in this article, and probably the last one as well. And it got huge attention. So it was I was still a specialist registrar, by the way, just to let you know. And I was working at Croydon University Hospital at this time. And it got a lot of attention. It was front page news of 3 newspapers, including the Times. I was debating with a professor from Imperial College about statins on CNN International News. I was on Fox News. It was crazy. It really had a huge impact, and it went on for months and months and months. And as many of you know, there was also later on calls for retraction by Professor Rory Collins, and there was a trial and all of that kind of stuff. And that's probably another story for another time. But the reason I'm mentioning this is that when this happened, and I've not said this publicly before, when this happened, about 2 days after it happened, I just started working in Croydon. And I was there as the interventional fellow, basically doing all the cases. I was sort of the main person doing all the angioplasty, all the keyhole heart surgery cases for my bosses. And I had a job there for a year. And about 2 days after this happened, and the nurses, the staff, they were overwhelmed. Croydon's name was on the in the newspapers. They were really happy. Well done, well done. And one day I walked in, and one of the secretaries said to me, he said, Aseem, the medical director wants to see you. And my gut was, this isn't going to be good. And but they were, oh, no, I'm sure he wants to congratulate you, for all you've done. Not sure about that. So anyway, so I went up to this chap's office. I'd never met him before. And he greeted me at the door, and he was red in the face. He was fuming. He was almost frothing at the mouth. And I went down, and I sat inside, and he just looked at me. And the first thing he said to me is, do you know your duties as a doctor? I've been speaking to the GMC about you. Now, several months ago, a journalist who's a good friend of mine, who I won't name, had said to me, Aseem, you're doing a lot of great stuff here, but be very careful because it just takes one phone call, and this may or may not happen, and I didn't believe him, really. He said the Secretary of State for Health could just make one phone call to the chief executive of the hospital and say, shut him up. Okay? I'm not saying this happened, but it was very interesting that he said he's speaking to the GMC. And one of the things he did, and I don't think I've ever told Tim this, but when the press release for the saturated fat article went out, I'd again asked Tim for one of his great quotes, for the press release. And Tim had said something along the lines of, after looking at all the evidence, I've concluded never prescribe a statin to a loved one. Now, Tim had tweeted this as well, and as I sat there opposite this chap, he had a computer screen, and he turned the computer screen round, and he had seen my retweet. He said, what is the meaning of this? And it was Tim's tweet, and there was a retweet there. I sat there very calmly, and I said, listen, this has been published, peer-reviewed in the BMJ. This is what the evidence says. We have a real issue. And he kept calm. He didn't say anything. He was quite polite by the end of it. And that was the end of that conversation. My job did not get renewed, and basically I had to, within 2 months' notice, I had to change jobs. Anyway, I moved on. I was okay. But anyway, let's say there may have been some influence of what I said there. Okay, so we move on. What had happened in the interim when I'd published the sugar piece, I'd been contacted by a number of academics, and they basically wanted to form a coalition to sort the sugar problem out, and they liked what I'd written, and et cetera, et cetera. So we spent a few months strategizing how we were going to have a big media push to say, a number of academics come together to say sugar is a problem. And Simon Capewell's quote in the press release was sugar's a new tobacco, and that was really a killer line. And the reason I mention killer line is what it'll be more relevance to you at the end. And when this happened on the front page of what is considered a right-wing newspaper, the Daily Mail, I knew we had won the battle for sugar, because we had a right-wing government, and they are most scared of the Daily Mail. And when the Daily Mail put this on the front page, that means they're backing it. There'd already been some mutterings, and I'd written several articles about sugar. There was more and more articles coming up. And they put this on the front page. This became a huge story in the early 2014. And then we didn't look back. It was crazy from then on. I mean, I think sugar has been in the news ever since. But the empire struck back. Within a few days, we had political backing from the chair of the All-Party Diabetes Group, Keith Vaz. And Keith basically put an early day motion forward with lots of other MPs backing what we were doing and saying, listen, yeah, we need to back these guys. We need to get sugar consumption down. It's a big problem. Andrew Lansley, I don't know how many of you know who he is, but he was a former Secretary of State for Health. And he got up in Parliament just after Keith Vaz had put the motion in, literally within a couple of days. And he basically said that the analogy between sugar and tobacco was inappropriate. Sugar is essential to food. He actually said that in Parliament. Sugar is essential to food. And I thought, anyway, I spoke to the editor of The Observer, comment editor of The Observer, and I thought, okay, well, this is a good time to, there's a lot of stuff going on here. This needs to be called out. So we called out Andrew Lansley, and I said that he would have been more accurate in saying sugar is essential to food industry profits and lining the pockets of its co-opted partners. Lansley was a paid director of marketing company Profero to the end of 2009. Profero's clients have included Pepsi, Mars, Pizza Hut, and Diageo's Guinness. And we didn't hear from Andrew Lansley on this ever again. That was the end of it. So I think that silenced him. Now, when I wrote the sugar piece and I called on SACN, the Scientific Advisory Committee on Nutrition, to update the guidance on sugar, I really honestly had not looked into their conflicts of interest. I'd suspected there may be an issue, but I hadn't done. And then Channel 4 and Dispatches basically found that 5 of the 8 members of SACN had some financial ties or institutional ties to sugar manufacturers. And I think that was really powerful sunlight for these guys, because really I think they were put on the spot. Because up to that point, they had been really responsible for, since 2003, advising. Now, you can argue the science wasn't strong enough, and that's fine. But for several years, there was good science that sugar was harmful. And they had been responsible for advising, essentially, that people should be consuming 22.5 teaspoons of sugar a day. So they got called out, and we had further progress. Jeremy Hunt called us, and I went to meet Jeremy Hunt. And then he asked us for a child obesity plan. And I think really this would not have happened without the media. Without the media really backing us and going behind this, I don't think we would have got as far as we would have got. And certainly the politicians also became more aware because they were reading things in the media about sugar. We move on, 2015, again, there was still a bugbear for me about physical activity and obesity, and I thought that, it's time that we need to put this to rest. So myself and Tim and Steve Finney, and a very, I think, another very courageous person who's here today, and a very courageous editor of the British Journal of Sports Medicine, Kareem Khan, he was very encouraging that we write this. So we wrote this editorial, and again, this had a huge impact. It was press released by the BMJ, and I think, I don't know, I think altimetric scores tell you how impactful they are, but it was pretty high, and I think it became one of the most read pieces of the British Journal of Sports Medicine for that year. And I think what was important there is, again, it had a lot of media impact. And what we also said in this is we needed there were still mutterings about sugar tax, and we said it needed a regulatory approach as well. We needed to bring a sugary drinks tax in, and that was one of the conclusions that we made. And, within a year, 2016, George Osborne announced a sugary drinks tax, which has just come into play in the last few months. So I think that's a huge victory from really 2013, if you like, about sugar becoming the major issue, to having regulation. So I think that's a really, really good impact for the population, and we will see that have benefits, I've no doubt, in the next few years. Okay, so I'm getting more towards the end of the talk now, but one of the things I wanted to do, and everybody said, Aseem, you need to write a book, and you need to sort of put everything that you've been doing and writing about into a book, an evidence-based lifestyle plan. So I liaised with Donal O'Neill, who's a film producer, as you know, and a former international athlete. He'd done Serial Killers, which was fantastic, and I'd watched. And we basically got together, and we went to this Italian village in southern Italy where Ansel Keys had actually spent a lot of time, but had really good life expectancy, healthy lifespans, to try and look at the secrets of the village and then marry that with all the best available evidence, really cutting through the BS, the misinformation that was out there, and try and give people a sort of new narrative, shift the paradigm in how they understand their health, how dietary changes can be very impactful very quickly, and how they shouldn't really fear saturated fat, but they should really cut the processed carbohydrates out of the diet. And we made the Big Fat Fix, which we were very honored that got a lot of support from many people here, and we actually crowdfunded because we wanted to remove commercial influence, and it was covered in the New York Times, and all of that really helped. We then wrote the book, The Pioppi Diet, which for me, as many of you who know me know that, I was what was most important for me is that this had impact on a very high level. That, the influencers, the politicians, those people would read the book. The establishment doctors, so that we could change medical training. And I sent it, and I spoke to the chair of the medical oral colleges. I had Cochrane researchers look at it, and all of them were good enough that they would give support, and they gave great endorsement. So for me, that was the most important thing. And then it got announced in Parliament. So Keith Vaz got up and suggested that all MPs with high prevalence of type 2 diabetes in their constituencies should follow the 21-day plan. The reason we called it a 21-day plan was because we wanted to also shift the narrative that dietary changes have an impact on health very quickly. So we wrote this book, and it got decent, sort of decent impact, and some very good reviews from the right places, and obviously mentioned in Parliament. Busting a few myths that I think many of you know now and acknowledge, but we need to really get it out to the wider public. And it was based upon science. We wanted to base it upon the best available evidence. So around just before that, actually, another editorial I wrote with Pascal Meyer and Rita Redberg, both practicing cardiologists, very eminent editors of medical journals as well, really wanted to reinforce this message that saturated fat does not clog the arteries. So look at the actual pathophysiology of what's the most likely cause of heart disease and how it develops. And insulin resistance is really the key. And I put this slide together, I put this sort of drawing together, which was put into a slide. And really, it's a little bit crude, but generally I think what it illustrates is if you concentrate on insulin resistance through the right kind of diet, which removes processed carbohydrates, reducing stress, walking every day briskly, most of 80% of cardiovascular disease we could probably tackle, both prevent and to some degree treat through these lifestyle changes. And this again, I think the fact that we had two other cardiologists involved, I think, helped really get more notice amongst the establishment, and I think it became the most read, again, piece in 2017 in the British of any BMJ journal. But I think this message really needs to be reinforced. But as expected, there was David Haslam, the former chair of the National Obesity Forum, wrote a foreword for the book and basically suggested that there will be slings and arrows that have already come Aseem's way, but probably will continue to come his way. And but I got a phone call from actually Zoe, I think. I was about to go on holiday, and it was November last year, wasn't it, I think? And she said, Aseem, have you seen the Daily Mail? Congratulations, something like the British Dietetic Association having a go at the PHC diet as a celebrity diet to avoid in 2018. The first thing I thought was like, celebrity diet? I said, I don't know any celebrities on this diet. But they had basically made BBC News. BBC journalists called me, and I was like, okay, here we go. So at least they gave me the right of reply, and it was a decent right of reply. But I think what was interesting was that the chief dietitian of the British Dietetic Association essentially made some absolutely false statements. I think she'd either not read the book or been misinformed herself. So I then hit back in the Men's Health in a long read and basically called the BDA out. They said that the book was recommending a high consumption of saturated fat, which it wasn't. It was exonerating saturated fat as a cause of heart disease, but it wasn't saying eat lots of saturated fat. They said that the evidence that we had used had been cherry-picked, which was also false because we had used systematic reviews to come up with this data as for the British Journal of Sports Medicine peer-reviewed piece. You know, the other thing was the Dwayne Meller, who's also one of the chief spokespersons for the BDA, had said that our plan of 21 days was not evidence-based, but there was clear evidence that dietary changes have massive impact in a very short space of time on whether it's type 2 diabetes or cardiovascular risk. So again, there was a number of false statements that were made. So I think what's interesting is when you look at John Cleese did this tweet a while back, and I looked at their cherry-pick statement, and I thought that was interesting. So on Wednesday, I was on Radio 5 Live to take part in a discussion about fats, and I was up against Susan Jebb, one of the government's chief nutritional advisors, and a dietitian from the British Heart Foundation, who I thought was actually very reasonable, very good. And the debate and discussion was generally quite civilized, up to the point where when Nihal, the presenter, talked about the change in the advice on saturated fat, he'd mentioned the National Obesity Forum Public Health Collaboration report. I said, what about this? You know, they said all of this. And Susan Jedd said, yes, well, it was quite clear that they cherry-picked, you know, the evidence and all that kind of stuff. And I said, well, no, I'm sorry. I think the people that are doing the cherry-picking, what concerns me are the establishment. They are cherry-picking evidence that suits industry and not what reflects the totality of the data in our patients and scientific integrity. So I think it's important for people to realize what's going on because, you know, there is a battle going on over here, and some people in the establishment who have a lot of eminence, in my view, are actually purposely cherry-picking data and accusing others who want to look at the totality of the data as doing the same thing. Now, there are many amazing stories amongst people here, friends, you know, we've all heard these stories, people going low carb, you know, this stuff does work, and I'm seeing many patients that are coming to see me that really within weeks to months of changing their diet, cutting out the processed carbohydrates, are coming off medications, are dropping their blood pressure. This is Stephen, who I've never met, and with permission he's allowed me to put this slide up, who posted on my Facebook wall. And this really keeps us going because for me personally, what really gives me more energy and inspiration to carry on in this battle, and it's not an easy one, is my patients. Is the fact that the patients are coming back and with their positive, amazing stories. And you know, he wrote this, which was really quite extraordinary story, but we know that when people actually put this into practice, it has an impact. Now, I don't know whether the British Dietetic Association have a psychic or some sort of clairvoyant as part of who works for them, but only last week, Sarah Cox, who is actually, I would say, a celebrity figure, probably the first one who's publicly come out, having heard me talk about sugar on the Jeremy Vine show, basically adopted the PHC diet for 21 days and has basically managed to have benefits already. And she concludes that and we all know this, when you cut the sugar, I feel leaner, energized, less bloated, and more healthy. I generally feel like this is no longer a diet plan. It's just the way I eat. So, yeah, maybe, you know, it now is a celebrity diet. I don't know. At the same time, now I'm not going to talk about this in great length, but we have this obesity crisis. We also have a massive problem with an over-medicated population. And a lot of the data that's driving clinical decisions has been corrupted by commercial influence. There's no doubt about that. The evidence for that is overwhelming. You know, and Peter Gosher is one of the co-founders of the Cochrane collaboration. His own estimate suggests that the third most common cause of death now after heart disease and cancer, prescribed medications, what your doctor prescribes for you. 50% of that is because of side effects, 50% of that is because of medication errors, but it's a huge problem. And these things are interlinked. You know, if we're going to combat the obesity and chronic disease, we also have to highlight the too much medicine aspect as well. They're not separate entities. They are very much interlinked. And we need to put one in front of the other. We've got an imbalance at the moment, as you know. But there's another problem, is that there is corporate crime going on. And between 2009 and 2014, most of the 10 largest pharmaceutical companies were found guilty of fraud and paid fines up to $14 billion combined for illegal marketing of drugs, hiding data on harms, and misrepresenting research results. So this is a major issue, and it's not being tackled head on. And a few weeks ago, I was invited to speak in the European Parliament and really highlighted this issue. And it was myself and some other eminent doctors, a former Queen of England's personal physician for 21 years, Sir Richard Thompson, who is a really great man. And he has been following this for a very long time. He was a president of Royal College of Physicians, so he's got a lot of experience, and he realizes this problem's been going on for a while. And we called for something called like a Chilcot-style inquiry, like into the Iraq War, to solve this problem, because I think it's so deep-rooted with academic institutions hiding research misconduct. We know there's a big problem in British institutions. And again, for me, when this was happening, I thought, you know what, let everybody, as many people as possible, know that we are talking about this, to get this information out there. Because ultimately, sunlight is going to be the most powerful disinfectant. And the reason this has gone on for so long is because people are not aware of it. I think most people are intrinsically good. They want to do the right thing, even people within these companies. You know, everybody is affected by this. Their patients, their friends, their family, us as individuals, when we go and see the doctor, we want to make decisions about our health based upon the best available information, which has been least corrupted as possible by commercial influence. So we call for a Chilcot-style inquiry. And in fact, just so you know, I also made sure that the chap who's in charge of the Science and Technology Committee, the chair of the Science and Technology Committee, Norman Lamb, who's an MP, I've had some message exchanges with him. He seems like a good guy. And I said to Norman, over a text message, I said, Norman, you know, they're currently looking at scientific integrity, and there should be a ruling on this in the next few weeks. But I said, listen, I think this is a much bigger issue. And ultimately, we need this Chilcot-style inquiry to sort this out, because I don't think tinkering on the edges is going to solve the problem. So he's aware of it, and let's see what happens. But you know, the people at the top know what's going on. And the other thing that's happened over the last several years, I've had the opportunity and privilege to meet many politicians across all parties, and I do keep them updated with all the stuff that's going on, and they are aware of what's going on. So hopefully that will continue to help to make change happen. Now, almost finishing up, just to reflect. So Simon Chapman is probably one of the most influential figures in Australia for tobacco control. So he wrote a paper, which is a great paper to read. You can access it. It's a free online access. He gives some advice about his 38-year career in public health advocacy. And he makes a number of points, which I think important for people to appreciate. So always respect the evidence. You remember the slide at the beginning, 50%, you know, science evolves. So respect the evidence, and if the evidence changes, so should you. Now, a lot of academics are still stuck in, you know, old dogma, and they're not changing for whatever reason. Some of it just because of intellectual conflicts of interest, some of it because they don't admit they're wrong. But, you know, medicine is not an exact science, nutritional science even less so. And I think we need to accept that as new information comes along, we need to adapt and change with it. Be clear and concrete about what you want to change or support. So, you know, our goal may be that we want to reverse obesity in a few years. Okay, so be very clear about that. Make those comments. Study the media. Without media attention, the chances of success are much, much less. You know, the more people that are aware of it, the more likely change is going to happen. You know, this is about making what is an injustice visible. You know, there has been a gross injustice that's still being committed on the good British public and people around the world because of misinformation, because of commercial influence. And if you make that injustice visible, it can change. Any revolution that's happened has happened because, you know, whether it's people like Nelson Mandela or Martin Luther King or Mahatma Gandhi, they have made their injustice visible through use of the media. use killer facts. So, killer facts know your information. Know that the average British citizen, for example, is consuming 20 teaspoons of sugar a day, and it should be closer to 6. These sorts of killer facts are really important. Other great lines. Type 2 diabetes is a condition of carbohydrate intolerance. You can't outrun a bad diet. This is for use of the media, for people to really acknowledge and understand what's going on. David Unwin has a great line. One thing that really annoys me when people say, you hear in the media and some commentators, oh, it's about everything in moderation. And I find it really annoying, and I just think, well, actually, what would be a great response whenever I hear that now? I use David's line. I say, well, actually, telling a type 2 diabetic to consume sugar in moderation is moderately poisoning them. That usually shuts them up. Values are everything, people make people care about it. These are affecting children's health, our health. There are great stories as well. I think experts are good. It's good that I can go up in front of the media and talk about something, and that has an impact. What has more impact is the patient story. It's people like Stephen who say, I'm feeling better. I ignored my doctor's advice, and I've reversed my type 2 diabetes. Those stories are very, very powerful. So having, for media purpose, for a story, when you read articles, there's always, if you notice, there's a patient story at the beginning. Because that actually, we're emotional beings. A lot of this is driven by our emotions, but then we obviously need to use evidence to support that. Use social media, huge way. Obviously, a lot of us here use social media, great way of getting the message out. Successful advocacy takes time. Simon Chapman talked about the fact that it took, in 1976, they first banned smoking on buses in Australia, but then it took another 30 years before they banned it in working environments. In fact, that was more important. It takes time. I think we've done very well within a very short space of time of getting awareness about sugar to get some impact, but it does take time. And last but not least, grow a rhinoceros hide. Okay? He says this, finally, unless you're an advocate of an utterly uncontroversial policy, as soon as your work threatens an industry or ideological cabal, you will be attacked, sometimes unrelentingly and viciously. And that's what Simon says. And I think, we know that this happens. There are many people here who have put their head above the parapet, and, even amongst colleagues in your community, but even on a scale in terms of mass media. But there's hope. We can do this. There are many public health successes which have gone through the same process, but there is a battle. And I think that if we carry on, that we will eventually get there. And this final slide, I'm going to credit to Sam. He doesn't know what I was going to put up, but actually Sam Feltham has been, for me, in terms of helping me with my social media, a lot of the videos that you see that go online, because I want to, obviously, if something happens, I want to get it out there so people can see what I'm doing as well. And Sam, without fail, I've called him up. By the way, I'm a complete technophobe. I have no idea how to do this myself. And without any fail, Sam, without any hesitation, he always does this for me and puts videos up of things I'm doing, which is great. And one of the things he did a few years ago, which I thought was brilliant, I thought I had to put up, is at the end of a discussion I was on, it was The Men Who Made Us Fat, and I was part of the Medical Royal College's obesity group, and we talked about the fact we need government regulation. And there was an interview, and Sam put this video together at the very end of this, and I said, we can reverse obesity if we do this, this, and this. And Sam put this brilliant sort of mock newspaper article at the very end, which I just thought, there is hope. We will get there in the next few years. And it was this, is that UK reverses the obesity epidemic. Now, can we get there by 2021? I believe we can. If we fight for it, we can do this. Absolutely, we can. Okay, so my final slide, one of my inspirations is Gandhi. Many people, especially ignorant people, want to punish you for speaking the truth, for being correct, for being you. Never apologize for being correct or for being years ahead of your time. If you're right and you know it, speak your mind. Even if you're a minority of one, the truth is still the truth. We are no longer a minority of one. We are actually the many, and those dark forces that put private profit in front of public health, they are the few, we are the many, and we can do this. Thank you.